Emergency Contraceptive Pill. Which pill should I take in an emergency to avoid pregnancy? Emergency contraception refers to contraceptive treatments that can be used to prevent pregnancy after unprotected intercourse. These should be used within 5 days following the active intercourse, but the sooner they are used, the more effective they are. Emergency contraceptive tablets prevent pregnancy by stopping or delaying ovulation and do not cause abortion. The copper-containing IUD inhibits conception by producing a chemical alteration in fertilization. However, an existing pregnancy cannot be disrupted by emergency contraception, nor can a growing embryo be harmed. But what is IUD? An IUD is a little T-shaped plastic and copper instrument that a doctor or nurse inserts in the female uterus. It releases copper to prevent pregnancy and protects against conception for 5 to 10 years. It's also known as a coil or copper coil. IUDs are more than 99% effective when adequately implanted. The IUD is similar to IUS, but instead of producing the hormone progestogen as the IUS does, the IUD delivers copper into the uterus. The copper affects the cervical mucus, making it more difficult for sperm to reach and nourish an egg. It can also prevent a fertilized egg from implanting itself. If you are 40 or older when you have an IUD placed, it can be retained in place until you hit menopause or no longer require contraception. In rare situations, when an IUD is inserted, it might cause a hole in the womb. It can be uncomfortable, although there are occasions when there are no symptoms. However, the danger is extremely minimal if the GP or nurse who fits your IUD is skilled. Now, let's discuss some facts about IUDs. IUD begins working as soon as it is inserted and lasts for 5 to 10 years, depending on the kind. As long as you are not pregnant, you can use it at any point during your menstrual cycle. A professionally educated doctor or nurse can remove it at any moment. It is, therefore, feasible to become pregnant immediately. During the first 3 to 6 months after an IUD is placed, your periods may be heavier, prolonged, or more severe. You may experience spotting or bleeding between periods. There is a slight risk of infection once it has been installed. There is a slight chance that your body will force the IUD out or cause it to relocate. Your doctor or nurse will show you how to check to see if it's in place. It may be unpleasant when the IUD is placed, but you can take pain relievers afterwards if necessary. If you have a history of pelvic infections, it may not be appropriate for you. This IUD treatment is considered to be one of the best ones for emergency contraception. Other than this, individuals can use hormonal pills in emergency cases too. When used regularly every day, birth control tablets are a method of contraception that is 99% effective at preventing conception. The tablet includes hormones that control menstruation, reduce the risk of ovarian and uterine cancer, cure acne, and avoid endometriosis. Because it comes in tablet form, it is referred to as the pill. Women take the pill once a day orally, and the tablet is most effective when taken on a daily basis at the same time. Taking the medication correctly may be challenging, which is why 9 out of every 100 women who use it will have an unexpected pregnancy each year. When taken regularly at the same time each day, the pill is most reliable. When women first start taking the pill, they may encounter prescription side effects. These adverse effects usually go away after a few months. Inform your doctor if you suffer any adverse effects. You might be able to switch to a different brand that isn't causing issues. Waiting out the symptoms for a few cycles, on the other hand, frequently helps alleviate many of the symptoms, especially when starting a new pill regimen. The possible adverse effects are tenderness or swelling in the breast, brain fog, nervousness or restlessness, nausea, and spotting in the interim. Now, how fast do hormonal pills work? The tablet might take up to 7 days to become effective in preventing pregnancy. You should use another method of birth control at this period. If the pill is used to treat symptoms like acne or irregular bleeding, it may take 3 or 4 months to see meaningful results. When used regularly every day, the birth control pill is a highly effective method of preventing pregnancy. The pill may help reduce your chance of developing certain conditions such as uterine and ovarian cancer, migraines, and acne. It is possible that you may need to test many different brands of the pill before you locate the one that works best for you. Many of you out there might worry if you are breastfeeding at the moment. The estrogen in the combination birth control tablet can reduce milk supply. If you are nursing, your doctor may advise you to use a progestin-only tablet instead. However, if a woman's milk supply is fully established and her risk of blood clots is reduced, some women may utilize estrogen-containing tablets. But which pills are best for this? It's always best to consult your doctor about this. Still, Esterilla, Femior, Monolinia, Mononessa, Orthotricycline, Previfem, Sprintec, Trilomarzia, Trinessa are some of the medicine that can work too. So, are you taking any of these pills? Is it helpful? Do comment down below. If you enjoyed the video, make sure to smash the like, share, and subscribe button. Share your feedback with us in the comment section. Thanks for watching.